So one thing that we get a lot of questions about, it's called the All Payer Claims Database, but it doesn't have every single payer in it. So we do get a lot of questions about the number of lives that are in the database, what's represented, very specific questions about what types of claims we get, and what kind of information is in the APCD. So we developed a resource very recently that is called, we are calling it the CO APCD Insights Dashboard. And it's a very robust tool on our website that I will show you guys here in just a minute. But it is available on our website under the Get Data tab, what's in the CO APCD tab. And we'll go through that and the different options that you have to understand the contents in just a minute. But just at a high level, this is a summary picture of what's in the APCD. So in terms of percent of insured population, we estimate we have about 65% of insured Coloradans represented in the APCD. And I should note that this is medical coverage only. So we pulled out just medical coverage. And when you look across all payers, we have about 3.4 million lives, unique lives that we represent in the Colorado All Payer Claims Database. If you look at medical, pharmacy, and dental, it's closer to about 4.5, and you can do that on the dashboard, and I'll show you how to do that. When we look at the types of payers that we have in the database, we do have 375,000 Medicare Advantage. That's that first NA. And the reason that that is NA is we are comparing to the census data to estimate what percentage of covered lives we have by payer type. So we don't have estimates that we were able to find, especially in the census data. So even though we're capturing a large portion of those people, we don't have the denominator from the census data, so we're unable to give the percentage. But we do have Medicare. We have estimated 63%. We do get feeds from Medicare fee-for-service, and we have 100% of the Medicaid population, excuse me. And then in terms of commercial payers, we estimate we have about 34% compared to what the census data says that we have here in Colorado. And that's broken down into the majority of what we're capturing is fully insured, not as many of the self-insured lives, which we'll talk about why that is the case here in just a second. So I think it's a little easier to think about what we're not capturing in the APCD because it is very robust and does represent a high portion of the population. But the big buckets are a federal program, so we do not get at this point in time any information from VA or TRICARE programs and the Indian health systems. We are working with the VA. We've actually been in contact with them for about 6 or 7 years now to try and work something out to try and capture some of those claims. So fingers crossed that will actually happen at some point in time, but that's a big hill to climb when you're looking at trying to get new information from a federal program. We don't have the uninsured in the database because if there is no claim associated with it, we do not get a submission. So we do not have uninsured lives. And then as I was mentioning before, self-insured employer plans, there is actually a Supreme Court ruling that happened several years ago that does not allow any states that to actually mandate submissions from ERISA-based self-insured employers. So we are capturing those that are not ERISA-based and estimate we're getting about 25% of the self-insured. We do have some voluntary ERISA-based self-insured employers who are submitting, and we're continually working on that. That's a big goal of ours, and in partnership with the state and some of the alliances that are forming here in the state. So we're looking forward to those numbers continually increasing over time, but right now it's a slow process to try and capture those claims. So in terms of the Insights dashboard, just some high-level information. It does provide trend information. So if you're trying to understand how does the database look back in time, we have the information available from 2013 to 2020. So you can sort by the different time periods of relevance, and you can see the trends in how many people are represented in the APCD and what types of coverage they have. So medical, dental, and pharmacy, because I know that those are big buckets that people are very interested in understanding. You also can see how many payers like in the commercial lives space. So we have by payer, individually named payer information in the Insights dashboard. And we also have information that will help you understand by payer, how many people they cover and what type of coverage, again, in those buckets of medical, dental, and pharmacy, and self-insured versus fully insured lives. And then also those breakdowns is very important to understand what portion of the population is being covered, and not just at the statewide level, but all of our counties are very different with the payer mix and self-insured versus fully insured. So we also have breakdowns by the county of interest that you might be interested in understanding what portion of the APCD or people in that county are covered by the APCD. And then we do get a lot of other questions in terms of other types of services. So behavioral health services is also a tab on the APCD Insights dashboard, which is not a claim type, but we are able to capture behavioral health services by looking at codes. And we'll talk about that a little bit more as well. So let me actually jump out. It's more exciting, I think, if I can demo for you what this looks like. So if you go to our website and you're on this home page, you can go to the Get Data tab, and under CO APCD info, you have an option to select what's in the CO APCD. So once you're on that tab here, we have some information at the top, some of those considerations. One thing to note right now, the data is only through June of 2020 at this point in time. We will be updating this frequently. And so after our July refresh, we will have a full calendar year 2020. And so we'll update the whole entire dashboard so that you will be able to see what the full 2020 looks like. So when you are looking at 2020 right now on the dashboard, it's going to look about half of 2019, which makes sense because it's just the first 6 months. So this overview tab here, let me move let's make it a little bit smaller so we can see the whole thing. When you're on the overview tab, you have some options to have instructions. If you're not really sure how to use it, you can click this button and it kind of tells you some of the things that you're looking at. You have the ability to select by payer types on this left-hand side. So if you're only interested, for example, in Medicaid, you can click on that button here. If you want to look at just one select year, let's pick 2019 since it's our last full year of claims data. Then you can see how many claims in total that we received from Medicaid in that year. And then you have the breakdown by medical claims versus pharmacy claims versus dental claims. If we want to go, but let's go back to all payers here. So in 2019, we had across all payers 102 million claims that came in. And again, you have that sortable breakdown here. We have 42 total payers. That includes Medicaid, Medicare, all the commercial payers. So we receive claims from all of those folks, with the exception of Medicare. We get them on a monthly basis. And then that represents about 5,000 people. Again, it's closer to probably 4.5, but this is unique lives in the APCD, but that could be people that may not live here anymore. And we capture those folks and keep them in the database, but at any given point in time, we may have more represented. It just depends on what point in time we're looking at here. In terms of the breakdowns by payer type, I think it's very interesting to be able to look at all of the different commercial payers. So Colorado is special in that we have a lot of commercial payers. Not all states have so many payers. And some of these payers are just going to be dental payers. So the breakdowns by medical, pharmacy, and dental, right now we're just looking at Aetna. And this is their insured people with claims, 500. But if we're looking at an isolated year, we'll go back to 2019 again. Their total insured folks is about 231,000. Of those 231,000, 148,000 people had claims. Again, we have the option to see what type of claims. So a lot of pharmacy, a lot of medical, not as much in the dental space here. And then we also have the breakdown by the number of people with self-insured that Aetna submits on behalf of, and then the number of people who are fully insured here. And then if we go to the next tab over, it's the insured people by population by county. As I mentioned before, sometimes if you, let's take Summit, for example, they were very interested in understanding what population was covered in Summit for the work that they're doing with Peak Health Alliance. And they're using this as a way to encourage self-insured employers who are working with the Alliance to submit their data, since that's a voluntary submission for most of them that are self-insured. So right now, we estimate for Summit County that we're capturing about 48% of the total population in Summit County, so roughly half. And then if you look at the denominator of how many are insured based on the census data, we're estimating that we capture about 57% of the population. So they're again using that as a tool to help encourage employers to submit their data so that we can get more of a larger portion of the population represented. And if you did select just commercial, that will sort this data even more. So when you're looking at just the commercial population, commercial represents about 25% of the total population. And then we have about 36% of the commercial population in the database for Summit County. So lots of stuff that you can do with that tab. Again, that's all based with, as the denominator is the census data. So it's not 100% accurate, but it's the best that we have here in terms of being able to sort by the type of payer. Behavioral health services is something that we've been capturing in the database for a long time. We've gotten better at it, I think, in terms of the submissions over time, and you can see that reflected here in the trend information. Again, this is not a claim type that gets submitted, but we have a whole list of CPT codes and other types of codes that we look at to estimate what and put them in the bucket of behavioral health services. So you can see that we have had an increase in total claims for behavioral health services over time. So we have about 8 million in 2019. And then that's growing as well. And when you look at just the number of unique lives with one or more behavioral health services, that has grown over time. And I'm sure it'll be interesting to see, given COVID last year in 2020 and the increase that we've seen in telemedicine with behavioral health services, to see, I'm anticipating this number will jump quite significantly when we have the full 2020 claims in this Insights dashboard. It'll be interesting to see how different the jump is, the percent increase. And a couple other quick things that you can do here. These are all trend information too. So you can see how over time we have increased the number of payers. So we had back in 2013, we had about 23 payers, 2014, and we've been jumping up over time. And this is by the claim type. So you can sort by medical here, number of payers who are submitting pharmacy claims, and then the number of dental submitters as well. Similarly, you can look at total claims over time by the claim type also, and total people by year, and then the population over time as well. And this is also broken down options to give yourself some insights by county as well. So there's a lot you can do with this, and our hope is that this is a tool that pretty much any kind of content of the APCD question that may come up for any of our stakeholders, this is a good resource to check into. If there's ever something that you don't see here that we could add to this, we are collecting feedback. This is our first release of this information, and we want to be able to continue to add information over time. And in fact, that is a good segue for me to go. I want to point to a couple more resources, because since we created this, we did get several requests to have a downloadable document that has all the contents that we just showed in the Tableau report. This is a downloadable Excel file that has all of the data available if there's a need for you to look at it in different ways. The behavioral health and substance use claim information that I showed you or was talking to you about before in terms of the types of claims, that's all listed in this downloadable Excel file. We'll talk about race and ethnicity data as well as dental and vision information. But this is where all of the resources that I'm about to go back to my PowerPoint presentation and show you, that's where you would get access to those. So let me pop back in. So this is again, all the other resources that I just mentioned. The behavioral health and substance use disorder services analysis does break down both behavioral health services over time from 2017 to 2019, and then also substance use disorder claims. And then there is that list of the ICD-10 codes that are considered behavioral health related, so that you can understand what goes in. A lot of things get categorized as behavioral health, but substance use disorder is separate from behavioral health. It's a separate category of behavioral health that isn't something that we have historically been able to capture because of federal regulations, but things are changing. The CARES Act actually expanded uses of substance use disorder data that is going to broaden the ability to use substance use disorder information and capture it. So right now, many of the payers are not submitting data to us related to substance use disorder because of the federal regulations that say if it was paid for, if it's actually a treatment that it is occurring in a facility that gets paid for by the federal government, that it can't be shared. But this is the CARES Act is going to help relax that. So we're just now figuring it out. We're starting to look into the regulations, starting to define how we can use substance use disorder data, for what purposes, and how that data can be released. Just establishing some business rules around IDing that data in the database once it starts coming in, and making sure we're partitioning it if we need to separate it out, so that we are appropriately using that data. We're also in the process of working with Medicare to request a separate substance use disorder file to supplement their submissions that they give us that are separate from substance use disorder. And then we're also working with Medicaid to make sure that we're aligning definitions. And once we do all of those things, we'll start working with the commercial payers to figure out, how do we engage them and help them understand how to submit the data and what those requirements might look like. So we're a little ways off from having that information. It's not going to be a quick process because we want to make sure we dot our I's and cross our T's. It's important to get this right and protect privacy. But we are excited that that will be information that stakeholders can start using eventually, depending on the regulations in place. But a lot of good research has been prohibited in the past because of this regulation, and they've known that they needed to find some solutions at the federal level. So the CARES Act is helping implement that. I think we might have had a question, so hold on just a second. Oh yes, just a reminder to feel free to chat in the chat box. Thank you. All right, so I mentioned that we have extra information on dental code claims, and this is again under the resource tab on the web page that I just shared with you on the Insights dashboard. But we've had some questions regarding what we have for dental information. So this analysis that's available, and this is just a snippet of the data that's available in the Excel file. We have the top 300 dental codes. So you can see on the left-hand side, the CPT, the specific dental CPT, what the procedure description is, and then over time, what the volume of claims looks like. Again, this doesn't go all the way through 2020, so that doesn't complete the picture there, but you can see increases in the volume of claims that we've had over time for dental. And vision claims is another one that we get questions about. We don't have this as a requirement in the APCD data submission guide for payers, so it's not really robust in terms of commercial, but you can kind of capture from the Excel file that we are getting some claims. The majority of claims coming in for vision are actually from Medicaid. But we do have some. So if there's a project that anyone's interested in terms of Medicaid specific vision information, we certainly have claim volume that would support that. This might be something that we collect in future data submission guide changes, but we're in the process of figuring out priorities for the next coming years. So we'll see where that falls. So we will be updating the dashboard that I just mentioned every 6 months or so. We'll probably try and incorporate some of that information that I just shared with you, the vision, the SUD claims, the dental claim information too, but we're asking for any feedback that you might want to see in the dashboard that would be helpful for you. Again, it's going to occur probably after our July 2020 refresh, 2021 refresh that will help us have a full calendar year 2020. Feel free to send me any direct feedback or directly to our info@civic.org. We've also had some folks recommend that we have age and gender distribution information. So not only just the population numbers, but how does that look in terms of age breakouts and male versus female, etc. And then number of people covered by the self-insured employer plans. I think we can do more to break out that information. And because of some of the conversations that during the legislative session, we've also had some requests for breakouts by large group, small group, and individual plans as well. So looking forward to enhancing the dashboard in the upcoming months, but please, again, feel free to reach out if you have additional suggestions.